In this section, I'm going to talk about how family members can help their relative with schizophrenia. The family environment is important in the recovery of individuals with the illness. Even though schizophrenia can be a frustrating illness, family members can help the process of recovery in many ways. The first is by encouraging treatment and rehabilitation. Medications and psychosocial treatments can help a person with schizophrenia feel better, engage in meaningful activities, and improve their quality of life. The first step is to visit a doctor for a thorough evaluation. If possible, it's often helpful for family members to be present at that evaluation, to offer support, help answer the doctor's questions, and learn about the illness. If medication is prescribed, family members can provide support in regularly taking those medications. Taking medication can be difficult. There will be times when the person with schizophrenia may not want to take it, or may just forget to take it. Encouragement and reminders are helpful, and family members can help the person fit taking medication into their daily routine. Family members can also be very helpful in supporting therapy attendance. Some ways to encourage therapy attendance are by giving reminders, offering support, and providing transportation to the clinic. Next, I want to talk about the role of family stress and support. Family stress is a powerful predictor of relapse. On the other hand, family support decreases the rate of relapse. Helping someone with schizophrenia pursue meaningful goals and activities can be very helpful in the process of recovery. It's best if family members try to be understanding rather than critical, negative, or blaming. It may be difficult at times, but families often do best when they're patient and appreciate any progress that is being made, however slow that may be. If family members are having difficulty being supportive, it might be because of what they believe is causing the disorder. Studies show that family members try to make sense of schizophrenia by determining its cause. There's a tendency to think of the causes of the disorder as either moral or organic. Family members who believe the cause of schizophrenia is moral believe it's caused by the individual's personality. So in other words, the individual is weak, lazy, or lacking self-discipline. Family members who believe the cause of schizophrenia is organic believe in the medical model of disease, meaning schizophrenia is a medical illness. The belief that the disorder is caused by moral weakness, laziness, or lack of self-discipline leads family members to believe that individuals with schizophrenia are able to control their symptoms. The belief that people have control over it and as a result are responsible for their symptoms can lead to feelings of anger and may prevent family members from being supportive of their relative. In contrast, belief in the medical model of schizophrenia may lead family members to believe that the symptoms are not controllable, and therefore individuals are not responsible for their symptoms. This leads to greater feelings of warmth and sympathy, and a greater willingness to help. Research has shown that family members who hold a medical view of schizophrenia are less critical of their relative than those who hold a moral view of the disorder. Family members' views on what causes schizophrenia are important because critical and hostile attitudes have been shown to predict relapse. Lastly, I want to touch on how important it is for family members to take care of themselves as well. Family members often feel guilty about spending time away from their relative with schizophrenia. However, it's important that they take good care of themselves. There are many ways to do this. Spending time alone or with other family members and friends is important for their own well-being. Family members may also consider joining a support or therapy group. Counseling often can help families and close friends better cope with a loved one's illness. The National Alliance on Mental Illness, also known as NAMI, is a great resource for finding support. Finally, family members shouldn't feel responsible for solving all the problems themselves. A diagnosis of schizophrenia can feel overwhelming, especially at first. Please get the help of a mental health professional if needed. That concludes our brief overview of how family members can help a relative with schizophrenia. As a reminder, family therapy and psychoeducation for schizophrenia are quite effective and definitely an option you might want to consider if you need additional support and assistance. Thank you for joining me for the Schizophrenia Education Series. I hope you found it useful.